Yeah, it's interesting. The treatment of lipid disorders continues to evolve. So we obviously have some pretty good therapies, like statins. But in fact, there's a lot of unmet medical need, a lot of people who still have high LDL, high triglycerides, and there's a lot of interest in trying to develop new therapeutic approaches. One of the really interesting things about the lipid field has been that human genetics has really helped us identify new targets for therapy. So specific genes that by targeting them or knocking down them or inhibiting them, we actually can lower LDL, lower triglycerides, potentially reduce risk of cardiovascular disease. So what that's led to is actually a real plethora of opportunities for targeting these new targets. Of course, antibodies is one. Antibodies target PCSK9, that's well known. Antibodies are targeting some of these other targets as well. But now we have antisense oligonucleotides that target the liver and hit the messenger RNAs. We have RNA interference technologies, siRNAs that also target the messenger RNAs. We even have interest in genome editing and going in and actually literally changing the genome as a way to target these. So lots of different platforms, lots of different new targets, a lot going on in the space that's really pretty fascinating. One of the well-established targets is PCSK9. Of course, we have antibodies that target that, but one of the really exciting developments in that space is an siRNA targeting PCSK9 called inclisiran. And we've known that is quite effective at knocking down PCSK9 and reducing LDL. What we've learned at this meeting is even more numbers of patients with established heart disease, patients with heterozygous familial hypercholesterolemia, that in studies that involve an injection once every 6 months, that this is highly effective at reducing LDL cholesterol, is very stable over that time period, and also importantly appears to be quite safe, really sort of in a way de-risking this whole platform of RNAi therapeutics. So that's one of the big advances that we've really seen at this meeting in terms of moving that particular compound forward to hopefully ultimately approval for LDL lowering. Two of the hot new targets for lowering triglycerides are ApoC3 and ANGPTL3, both identified by human genetics, both clearly showing that if you have mutations in these genes, you lower triglycerides and you actually protect against coronary disease. So a lot of interest in targeting these two. There is an antibody to ANGPTL3 that's in development, but there's also an approach using siRNAs and even antisense oligonucleotides that target these two genes. And what we heard in a late-breaking session is that, in fact, siRNAs targeting either ApoC3 or ANGPTL3 in a single dose early phase trial were highly effective at knocking down each of these genes and reducing triglycerides as a result. So again, early days, but suggesting that this platform is a potential way to target these very interesting new targets that lower triglycerides. There's still so much unmet medical need in treatment of cardiovascular disease. And I'm confident that the big human genetic studies that are being done really across the globe are actually helping us pinpoint new genes and new pathways that are related to cardiovascular disease that are going to be potentially targetable for therapeutic reasons. So I think the cancer field really went down this path a decade or so ago, and now we're seeing in cardiovascular disease we're starting to find these new pathways. We're realizing that some of them actually are targetable in a way that allows us to treat or even prevent the development of heart disease. And I think we're going to see an explosion over the next decade of these new pathways being targeted by these different platforms, not just small molecules, but antibodies, siRNAs, antisense oligonucleotides, targeting them in a way that really is going to revolutionize our ability to treat cardiovascular disease.